Mrs. Mia Jones was hospitalized in the medical ward 4 days ago because she is suffering from a pancreatitis. Following his usual daily round, the nurse checks the client's medical file for new medical orders. The medical prescriptions include a lipid profile and a CBC. Blood sampling is to take place during the nurse's morning round. The client has been informed about the restrictions to respect before the analysis, which in this case involve fasting. Before seeing the client, the nurse checks the orders in her medical file and prepares the identification labels for the samples to be collected. He also prepares the venipuncture tray before heading to the client's bedside. In compliance with the infection prevention measures of his establishment, the nurse proceeds with hand washing before entering the client's room.
Okay, so just to confirm, can I ask you for your full name as well as your date of birth?
My name is Mia Jones, and I was born on March 22nd, 1994.
Perfect.
It is mandatory for the nurse to ask the client to provide her full name and date of birth and to cross-check them with those written on her bracelet. This double identification procedure reduces the risks of making mistakes.
Which test did the doctor order?
So today the doctor's ordered a lipid count as well as a CBC. So that's going to let us know if your situation has improved or not.
All right.
The nurse prepares yellow and lavender sampling tubes in accordance with the tests ordered by the doctor. The tubes must be placed in the right sequence in order to prevent cross-contamination caused by the mixing of the additives contained in each tube, and which would, in the end, provide false results. If the first tube is used for coagulation purposes, it will be rejected, or a tube without additives will be used in order to prevent mistakes from occurring during sample analysis.
Okay, so if I could just get you to put your arm down here, palm up. What I'm going to do is I'm going to apply a tourniquet. That's going to engulf your veins so I can choose the most adequate one.
The nurse must choose a straight, not curvy, and soft vein that is of the correct caliber. The veins located in the bends of the elbows are usually preferred since they make venipunctures easier. To choose a vein, the nurse installs a tourniquet 10 centimeters above the puncture site to make the vein swell. The tourniquet will be removed while the material is being prepared. Never leave the tourniquet in place for more than 60 seconds. Doing so could alter the results. If, regardless of the reason, the tourniquet needs to be taken off, the nurse must wait 2 minutes before putting it back on.
Well, I don't really like needles, so please take your time and pick a good vein.
Okay. Do you want me to let you know before I insert the needle?
Yes, please.
Okay.
The nurse selects the needle based on the vein to be punctured. The caliber must fit with the size and condition of the vein. A 22 gauge or a 21 gauge caliber needle is used for normal veins and 22 gauge for difficult ones. He puts the needle on the barrel. He then prepares the material required: a chlorhexidine pad with 70% alcohol, a rayon ball, and a strip of medical tape.
Okay, so what I'm going to do is I'm just going to put on my gloves, finish setting up here, and we'll be ready to go.
All right.
Wearing non-sterile gloves protects the nurse against the client's biological fluids and prevents the transmission of pathogenic agents. The nurse installs the tourniquet 10 centimeters above the puncture site. A tourniquet installed too close to the puncture site could make the vein burst. The tourniquet must be put on tight enough to make the vein stick out. The puncture site must be disinfected with a chlorhexidine pad with 70% alcohol using a spiral movement that goes from the middle of the site outwards. In all, the disinfected zone should be 5 centimeters in diameter. He will then let it air dry for 30 seconds to allow enough time for the antiseptic to be effective. Disinfecting from the center outwards prevents the disinfected areas from being recontaminated.
Okay, so I need you to take a deep breath.
The nurse uses his non-dominant hand to pull the skin about 2.5 to 5 centimeters under the puncture site. Doing so enables to stabilize the vein. Using his dominant hand, the nurse takes the barrel and holds the bevel of the needle facing upwards to facilitate insertion into the vein. The nurse inserts the needle at a 30-degree angle and then lowers it to 15 degrees once it is in the vein. This will avoid piercing the backside of the vein. He then uses his non-dominant hand to hold the barrel. With his dominant hand, he inserts the tube and pushes on it to pierce the rubber membrane with the needle found inside the barrel. Holding the barrel this way allows to stabilize the needle and keeps it from moving and piercing the backside of the vein. As soon as blood appears in the tube, the nurse removes the tourniquet to prevent hemolysis from occurring. Once filled up, the nurse replaces the first tube by a second one. To do so, he holds the barrel in place and removes the tube without moving the needle. He then removes the needle from the client's arm and places a rayon ball on the puncture site and applies only a light pressure on it to not damage the vein. The nurse puts a light pressure on the puncture site for 15 to 30 seconds and uses a strip of medical tape to keep the rayon ball in place. The pressure applied obstructs the flow and causes hemostasis. If the client is undergoing anticoagulant therapy, it is mandatory to apply firm pressure for at least 5 minutes. He then discards the needle into the biohazard sharps container and gently inverts the tubes to blend the contents and prevent clotting.
Okay, so how are you feeling?
I'm okay. I didn't feel anything.
Perfect.
The nurse removes the underpad and discards it in the designated receptacle. He then does the same with his gloves to avoid the propagation of pathogenic agents. Finally, he labels each blood sample tube and places them in a carry bag. Labeling the tubes will prevent errors.
Okay, so you feel comfortable like this?
Everything's all right.
Perfect. So if ever you feel any discomfort or you don't feel well, feel free to hit the call button, and I'll come see you.
All right, thank you.
Okay.